Buchanan from Iltalehti, I believe that's the right pronunciation, news outlet in Finland. Mariki, are you with us?
Yes, I'm here. Thank you. That was okay pronunciation. Yes, I wanted to ask about mental health actually and the lockdown measures. And how is the WHO monitoring mental health effects of the epidemic and the lockdown measures? And also, as many countries are now still keeping these lockdown measures a lot in place, at what point should we start to think more about making maybe mental health a priority of people also, as this can have a very long-term effect on people and also kill people? So how are you balancing the situation basically with mental health and also obviously dealing with the virus?
Thanks very much, Mariki. And this was indeed a dedicated topic of a press briefing that we held here in the regional office just 2 weeks ago. But I'm going to pass the floor first to Katie and then to Manfred to speak a little bit about mental health, psychosocial health with relation to older population. So Katie first, please.
Thank you very much, Mariki. Absolutely. We've been providing recommendations to the overall general public in this very stressful period that for all of us is quite difficult when we're dealing with lockdown or stay-at-home orders. Particularly for those with mental health disorders, there's been an attention towards those. There is specific mental health and psychosocial guidance that's issued by WHO. And we, of course, highlight those groups as being especially vulnerable in this current period. In terms of the transition out of some of these more restrictive measures, we're putting a significant emphasis on reinstating and ensuring that essential health services are being provided to populations, and people are coming to adjusting themselves to this new routine and new life. And over to Manfred to say a little bit more about some of the older age group.
Thank you very much. Specifically for those living in care homes, the situation is even more severe when it comes to the consequences, the mental health and the psychosocial consequences of being in a home for extended time with having no direct contact to visitors and very limited ways of connecting to their loved ones. Part of the measures that we can take are covered in the guidance that Katie has just mentioned. But what is very important for us is to look in a midterm perspective. Clearly, we cannot have bans of visitors for a long time, even for another number of weeks or months, without having special measures within the homes to help older persons and other residents to establish contacts. We have seen there are very nice examples that some care homes are setting in place, from using some technologies, simply helping to have more phone calls, videos, but even maybe letting older persons come out and then have some contact with physical distancing. Of course, what we are very aware of is that all these very necessary measures, they have their price. It's additional time that staff has to spend on these. And also, usually they very much like to do it. We also need to make sure that there are sufficient staff who can do this, I think some of the staff. So in short, many staff in care homes, they make an amazing task on that, but we really need to make sure they are supported specifically for the months to come. Thank you.
Thank you very much, Manfred, and thank you, Katie, and thanks for the... So we'll go to Jamie Keaton from AP, Associated Press. Jamie, you with us today? Welcome.
Good morning. How are you?
Good. Please go ahead.
Thank you. I have a couple of quick questions. First, Dr. Kluge, you mentioned that up to half of the deaths in facilities, extended care facilities, maybe half of the deaths may be coming there. What is the floor on that, for example? I mean, in other words, you said up to half, but what is the bottom level of that? And then my second question has to do with what you are seeing in terms of the correlation that you might have seen between the diverging rates of deaths across Europe, country to country, and the speed of lockdown measures. We've seen some studies about that. And particularly with regard to Eastern Europe, are you concerned about the quality of the numbers that are coming from there? Thank you.
Please, Regional Director.
Thanks, Jamie. I will take the two questions in one. So there is a lot to say about the mortality rates and the case fatality rates. The key issue is that it's not an indicator for the performance of how a particular country is dealing with the pandemic, because there are many, many questions, both at the denominator, meaning the people who are dying, and the denominator, meaning all the people who are infected. So we see a huge variety between those the different countries and those numbers. What we do know is that more men than women are dying. Number two, that up to 90% is above people above 60 years. And third, people with comorbidities, meaning with other underlying chronic conditions, particularly cardiovascular diseases, followed by diabetes, followed by renal disease. About Eastern Europe, I was mentioning in the statement, we have sent a mission to Belarus, and we're gearing up for Tajikistan, Turkmenistan, but we have country offices in all those countries. And we, the speed of the lockdowns in most of the countries, I mean, is quite fast. Physical distancing measures are being put in place, but it's too early, let's say, to have conclusive lessons on, for example, the mortality. What we do see is that they're walking. So if physical distancing measures are being put in place, that a couple of weeks later, the trend is decreasing. But that does not mean that we have to be complacent, because there are many, many unknowns still what the effect will be of the upcoming season. Many, many questions about the immunity. So in that sense, if the economic and the social and the population pressure is too high on governments to keep the lockdowns, then it really has to be done in a gradual way. And we have developed a number of criteria on those based on risk assessment.
Thank you very much, Regional Director. So we'll next go to Ioannis Gornanitis from the Inside Story Greece. Ioannis, are you there? Maybe not. Ioannis, we're not hearing you at the moment. Very well. We can't hear you at the moment, so I'm gonna move on. Can we go to Jaromir Mirhal from the Czech news agency? Jaromir.
Yeah, can you hear me?
Yes, we can. Please go ahead.
Yes. Okay. Hello. I'm from a Czech news agency from Czech Republic, Prague. My question is: some countries, for example, Czech Republic, are now discussing the possibility of opening the borders for tourists from some neighboring countries like Austria or Slovakia this summer. What do you think about it? Is it a good idea? Do you support it to open the borders for tourists? Thank you.
Thank you, Jaromir. I'm going to pass that question to our regional director.
Thank you, Jaromir. Tourism is a hugely important economic sector in Europe and globally, and has been indeed disproportionately. Uncertainty is that it happens gradually and taken into account a number of criteria which you have put in our WHO European framework, that there has to be evidence that the epidemic is being controlled, number one, that there is a capacity of the public health and the health system sector, including the hospital, to deal with a potential resurge of COVID-19 cases. Third one, that the society, the people are very well informed and aware that it's not an on and off, but it's potentially cycling forward and some steps back, that measures are being put in place at the work environment of physical distancing and hand hygiene, and also that the country is able, particularly in the question that you're mentioning, to manage import cases. So this has to be done really putting the right surveillance and responsive measures in place. No any place for complacency.
Thank you very much, Regional Director. Yanis, I see actually that you've submitted a question in advance. So as we can't hear you, I will try and deliver the question that you delivered to us in advance alongside two or three others. I think this is for Katie Smallwood. Yanis Goranitis, this is from Inside Story Greece, Katie. Given that most scientists remain doubtful regarding the degree and duration of acquired immunity, how would you comment on the idea of using immunity passports in order to reopen the economy, and especially sectors like tourism and hospitality? Do you worry that certain countries, including Greece, that seem to have flattened the curve, could face a second wave because of the affluent use of immunity certificates? Katie, please.
Thank you, Rob, and thank you, Yanis, for the question. I hope that was the question you wanted to ask earlier. Absolutely, we're worried about second waves, and in general, in all countries. We don't know how the virus is going to behave in future, but certainly we need to be monitoring the risks very, very closely over time. In terms of serological testing and the interpretation of those tests, for WHO, it's important to state that we value seroprevalence testing in the community to give an indication of who has been infected in the communities. It gives us a population-based level to understand the overall rate of infection. We cannot draw certain conclusions about the results of those tests for specific individuals at the moment for several reasons. One, because there's a margin of error in the test result itself, and these tests so far have not had the validation that gives us full certainty on the results. Secondly, as you referred to, we have still an incomplete understanding on the immunity that is conferred after infection, and this is incredibly important. So we would advise very, very much caution in interpreting these types of results at the personal level, and certainly in using them for determining whether a person can return to work or other types of decisions, which also have broader ethical and implications that we need to treat and understand much more fully.
Thank you very much, Katie. So next I'm going to go over to Denise Rowland from the Wall Street Journal. Denise, welcome back.
Hello, can you hear me?
We can. Please go ahead.
Thank you. Coming back to the care homes situation, certainly in the UK, here where I'm based, and in other countries too, the perception seems to be that people in care homes are being left in the care homes and not admitted to hospitals for more, I guess, specialised treatment. And I just wanted to get a sense of whether that's appropriate, given the frailty of these patients. Is that what the WHO would advise, or is it important that people are transferred to hospital from care homes when they worsen? Because I guess the number of deaths in care homes is suggestive of the fact that people are not receiving the the best care they could, but maybe the frailty of these patients means that they are more likely to succumb to the virus anyway. But what is how do you read that, and what is considered best practice when it comes to handling cases that develop in care homes?
I think on this we'll go to Manfred and then to Katie. Manfred first, please.
Thank you, Dennis. Very important question. Well, first, access to medical care, including care at hospitals and intensive care, is a basic human right for everybody. Also, in the COVID situation, older persons have a right to be transferred to the hospitals to receive intensive care or other hospital care if needed. Now, where the situation has exacerbated so that the capacities might be not there to treat everybody at the same time, again, it is important that the decisions, that very tough decisions that have to be made, are not based on a single criteria like age per se. So to see what is a likely outcome of intensive care in a hospital or hospital care, it is important to look in a multi-dimensional way on preconditions, overall health, but health per se should not be the overriding criteria here. And for the empirics, we know that many people who receive care at very high ages can recover if cared for adequately. For you, Katie, to add?
Thank you, Manfred. Thank you very much for the answer, and I'll just only add that, of course, personal choice is also something that needs to be considered in these decisions. But the referral systems to more advanced clinical care need to be in place in all of these long-term care settings, and they need to be organized with all due attention to infection prevention and control. That means that patients need to be referred to health facilities where they can be cared for safely and receive any advanced care that they need. And then when they're discharged, this discharge procedure needs to be done in a manner that ensures that patients are tested negative before they are discharged from health facilities back into the care home. Because what we certainly do not want to see is patients returning from healthcare facilities into care homes that may still have the potential to spread the disease in those settings. Thanks very much.
May I just follow up with a question? Given the statistics that up to half of deaths are happening in care homes, can we draw from that these patients are not being transferred to hospital in the rate that they should be? Can we conclude that from that information, or is it difficult to to infer that from what we're seeing in the numbers of deaths?
Katie, did you get that?
Yeah, thank you, Rob. I would simply say at the moment, because we're not receiving detailed information from many of these settings, we need to be very careful in interpreting those numbers at the moment, and we'll need to look at it more closely, and WHO will try and do that in the following weeks and months.
Thank you very much. So next we go to Kostas, was the specific point that Kostas was making here.
Thanks, Rob. Kostas, I'll try and respond to the question. I'm not sure I heard it all, but certainly I would say that as measures are adjusted to the epidemiological situation, and as small businesses start to reopen and take up their essential services for our communities, all protective measures need to be implemented. And when we talk about that, WHO always comes back to the basic things, that hand hygiene, i.e. regular washing of hands, is imperative, that any respiratory illnesses are, anyone with a respiratory infection stays at home and does not return to work or does not frequent businesses if they're clients, and that as surfaces are cleaned as much as possible. With regards to hairdressing salons.
Yes, hello, hi, can you hear me?
Yes, we can. Please go ahead.
Okay. So about the deaths in nursing, about half of the total deaths in the European region were in care homes. Am I right in thinking that would be about 55,000 people? And can you break that figure down to how many in Britain? And I was under the impression that very few countries were reporting care home deaths in Europe. So how do you know what the figures are, and do you think that could be?
We do not have the data from all of the countries on the number of deaths in long-term care settings, and it's very important that we recognize that. As information comes in, certain countries are providing and collecting that data, and we do have that data available from some countries, but that's certainly not a majority of countries across the region. I think the 50% number really signifies that from those countries that are collecting and providing that information, up to 50% of the deaths that have been reported may have occurred in long-term care settings.
Thanks very much. Right, next we'll go over to Gunilla von Hall from the Svenska Dagbladet.
I'm so sorry, could I have a very quick follow-up?
You may, if it's quick.
Yeah, just wanted to know if Britain was one of the countries which had given in figures for care homes or not.
Katie?
I don't think we have the full up-to-date numbers from the UK on care homes, but I have seen numbers provided by health authorities in the press with regards to that, but those are not WHO reported information. Thank you.
Thanks, Katie, and thanks, James, for those questions. Next to Naomi Kresge from Bloomberg. Naomi? No, we don't have Naomi.
Can you hear me?
Yes, we can now. Please go ahead, Naomi.
Thanks for taking my question. Do you think that proactive screening to check for virus cases, so testing even before symptoms pop, will be necessary in order to prevent the virus from spreading in nursing homes? Should this be a priority for how tests are allocated within countries?
Great. Thanks very much, Naomi. Again, over to you, Katie, on this one, and then I'll ask whether Manfred wants to take the floor thereafter.
So WHO's recommendations are that every suspect case of COVID-19 are tested, and countries need to prioritize long-term care settings that are at higher risk of infection in that sense. Depending on capacity, some countries have taken a more broader approach to testing in these types of settings, and that can be done, but that needs to be carefully balanced against the number of testing capacity that the country has overall, and those are decisions that can be taken country by country.
Okay, thanks very much. I'm just going to check one more time. Gunilla von Hall from Svenska Dagbladet.
Yes, thank you for taking the question. It's Dr. Kluge. I have two questions. The first one is more and more virus experts are saying that this virus will spread over years, up to 5 years. It's something we have to live with, basically, and coexist with, even in Europe. Do you share this view? How worrying is this, and how it is a country that has chosen a different strategy with a completely open society, no lockdown whatsoever, in order to create herd immunity? What do you think about this strategy? And is a population like Sweden more protected when countries are opening up because we've been exposed, while countries who've been in lockdown would be more vulnerable for a second wave? Thank you.
Hans. So on the first question, no one knows exactly about the number of years, but the fact is that we're living in a planet of viruses. In 2002, the SARS. In 2009, we had H1N1. We had the MERS. So in that sense, we have to live with potential and current outbreaks, whether it is coronavirus or other ones. So in that sense, we are moving towards a new reality. Coordination of development of vaccines and treatments are being sped up, but even if there will be vaccines, it's very important that there will be equitable access. So in that sense, the key issue for the time being is for governments and societies to implement what we know of and to have indeed a mindset that the virus is going to stick with us for a while. If not this virus, then either another virus possibly. On Sweden, as of today, we don't have any proof of herd immunities. A number of countries have studied this, but we also have to be very careful here because there is no WHO pre-qualified serological tests to detect the antibodies as of today. So again, we have to implement what knows which works, which are blended strategies. Containment, mitigation, and then non-pharmaceutical interventions. What we do know is that the trust in adhering to measures implemented by the government is indeed an important factor. If people are really adhering to physical distancing and to the hand hygiene, and respiratory hygiene is one of the factors that really plays. But we are learning every day still.
Thank you very much, Regional Director. So we'll next go over to Marcus Wackett from Reuters. Marcus, are you there?
Yeah. Yes, hello. This is Marcus Wackett from Berlin. Can you hear me?
We can. Please go ahead.
Yeah, Berlin, Germany. Yes, I've got a question concerning Germany. The reproduction rate or infection rate in Germany is now at 1 or a little bit below. But it has emerged that this was the case even at the end of March, before the strict lockdown was taken into place. So in other words, in the past 3 weeks, the infection rate has not gone down anymore, despite the lockdown, but despite the closure of schools and shops. Have you looked into that, and have you any explanation for that?
Katie, I'm going to pass Marcus's question on to you, please, regarding Germany.
Thank you very much, Marcus. So Germany has been implementing from the very beginning a broad range and a combination of measures to stop and control the spread of the virus in the German population. The later interventions, the most restrictive interventions implemented by Germany later on will have contributed to the decline in cases that we're seeing in Germany. But it's not the only measure that's been implemented, and we need to look much more broadly when we look at what actions have been taken by countries and how they have impacted on the spread of the virus. As we see in Germany, the cases continue to decline. This clearly shows that the interventions that have been taken in Germany are working, and I think we would support Germany in its response in that regard.
Thank you very much, Katie. Right, next on to Antonio Broto from EFE. Antonio.
Hi, good morning. Thank you for taking my question. So the term new normal is being increasingly used by the WHO. How this new normal will be? Will be a world with more use of masks in the population? Will be a world with more investment for health industry? What do you anticipate for the future?
Okay, I think I'll pass this one to the regional director, and then I might ask Katie to add a few points after that. Thank you.
At the political level, I would say that a new normal would recognize health as a top political priority. For many years, there has been the mantra that health is a driver of the economy. Health is national security. Now it's very clear that the painful lesson, without health, there is no economy, there is no national security, and there is really a need for global solidarity, because even if one country has positive developments, but surrounding countries or countries even in another continent don't have the epidemic under control, then everyone is in trouble. This is one very important point of a new reality. The second one is a reality in which the public health workforce is really appreciated, because public health workforce is often undervalued, because if the public health is doing a good job, everything is quiet. But if there is an outbreak, then the public health is in the spotlights. So public health really needs to be a workforce with a increased prestige. Now on the more operational elements, I will pass to Katie.
Thank you very much, Regional Director. I would only add that there's going to be a broad combination of interventions that come into play in the new normal. And one very big part of that is continued and aggressive surveillance systems that are able to pick up any cases as they occur in any country, in any community around the world. Because as we know, if cases are still present in one country, there's still a global risk for COVID-19. And this really comes down to the most local levels. So any action taken at the local level has an impact at the global level. And so we must be able to understand where those cases are. So I just highlight the ability to find cases, and secondly, the ability to react very quickly to a changing epidemiological situation in any one country.
Thank you very much, Katie. I'll keep you on the spot. Gorzinski from the to hold presidential elections, and at the moment it looks like the voting will be wholly done by mail. Given what is known about the virus spread via paper and other surfaces, is that a significant public health risk? What would the WHO advice be on this? Have the examples of elections in Bavaria, postal, or France in person provided any insight into this? Katie, please.
Thank you very much, Rob. So as we know, the virus spreads between people through respiratory droplets, and sometimes respiratory droplets that are able to contaminate surfaces. So based on the information we have so far, the risk is relatively low of persons contaminating commercial goods as they're transported, or letters. Secondly, as letters are posted over a period of days, the risk of the virus remaining, if it has been contaminated, which is low in the first place, the risk of it remaining viable in different temperatures across days during a postal system is also very low. So overall, we would see that level of risk as low, and we would see that, based on the information we have, that the overall transmission of the disease is really driven by human contact and close contact between people.
Very good. Thank you very much. Next to Irem Koka from the BBC. Irem? I believe it's
hi.
BBC Turkish.
Hi, can you hear me?
Yes, we can. Please go ahead.
Hi, this is Irem Koka from BBC Turkish Service. I would like to ask specifically about Turkey to Dr. Kluge. In your past previous press conferences, you said you're worried about the situation in Turkey, especially in increase in Istanbul. So why are you still concerned about Turkey because of increase in the cases, and why you are concerned, and how do you see the recent trend in Turkey? Thank you.
Please, Regional Director, or then we go to Katie. Maybe you've got the data on Turkey, and you can help us with this question, answering this question. Could you kindly take this question?
Yes, I hope you can hear me. Thank you very much. So in Turkey at the moment, we're seeing close to 100,000 cases. And over the past week, we have seen an approximate increase of cases of 47%. So we are still seeing some level of increase. However, the overall trend in Turkey, on the basis of the measures that have been implemented, and very early measures were implemented in Turkey, the number of cases is beginning to come down or beginning to stabilize. So overall, I would say that we are seeing cautiously optimistic signs in Turkey that the number of cases is stabilizing.
Great, thanks very much, Katie. Next, we go over to Sarah Wheaton from Politico. Sarah?
Hi, thanks for taking my question. We saw recently a study from Paris showing that cigarette smokers seem to be less likely to be hospitalized with COVID-19, and I believe they're now starting a study in France trying nicotine patches. I just wanted to see if this is something you've looked at, maybe how it compares to other research.
Okay, Katie, I'm going to pass that to you. I'm not sure you have that data available, but I'm going to pass that over to you to answer, please.
Yes, absolutely. I think based on the information we have, and I think we can be quite clear here, is that cigarette smoking is certainly a factor that may contribute to more severe COVID-19 disease. And that's on the basis of all of the scientific evidence that's available to us, that smoking may be much more linked to lower lung functionality, and therefore make people more susceptible to a severe form of COVID-19.
Super. Okay, so on that note, we'll close today. It only remains for me to thank our panelists and the regional director sat here in Copenhagen, in the UN city in Copenhagen with me. and to thank the press corps for joining us, and to welcome you to join us again, same time next week. So in the meantime, stay safe, stay well, and we'll see you then. Thank you.
It was quite hard for the authorities to follow up all the requests